Stents in the Cath Lab by Madeline Griswold, Robson Merrill, Rick Giddings, and Courtney Bell Russell. This presentation is on stents in the cardiac cath lab. The facts of the case is there were unwarranted medical procedures performed by Dr. Know-It-All. When reviewed by his peers and physicians outside the hospital organization, they were deemed unnecessary and outside the standards of care of a physician in his position. Dr. Know-It-All also has a large financial liability for his family. His children are in expensive private schools. His wife does not work outside the home. They have a live-in nanny, a housekeeper, and a groomsman for the horses. They also have a house outside the state, and as well as a lavish residence in-state. When asked, he voluntarily steps down from doing procedures during his investigation. Dr. Know-It-All is also in direct contact with the stent company and provides consultations, luncheons, talks for the company. Dr. Know-It-All states he's done nothing wrong, is working for the benefit of the patient regarding the procedures, and claims he's not being incentivized by the device company. At the conclusion of the case, he surrenders his medical license and stops practicing in the state of Nebraska. The defense and the prosecution would be the hospital versus Dr. Know-It-All. The defendant, Dr. Know-It-All, argues that he has done nothing wrong, he was operating with the patient's best interest in mind, and he was not incentivized by the stent company. However, the prosecution, or the hospital, has launched an investigation showing that this may not be the case. They have gotten peer cardiologists that do not work for the hospital system to review hundreds of his cardiac stent placements, and they agree that they were not up to the standards of care and not indicated due to the occlusion not being severe enough. They were less than 70%. The reviewers also noted errors or fabrications of data from documentation and overreading of test results on the part of the defense. Organizational behavior problems. Standard of care and ethical issues. Dr. Know-It-All did not follow proper standards of care, performing unnecessary procedures on patients that were not medically warranted. He performed the PCI or stent placement when there was less than a 70% occlusion, which was the standard of care, stating that they were warranted either by misreading or overreading the patient's test prior to the procedure or fabricating data. It appears that the additional stents that were placed may have given Dr. Know-It-All financial gain. His financial liabilities possibly have prompted the unnecessary procedures. It also appears that Dr. Know-It-All is receiving kickbacks from the stent company, either for placing stents or doing luncheons and presentations for the company due to his lavish living conditions and lack of any other financial support for the family. He has no other job, the wife does not work, and other physicians that have his same pay grade are not able to keep up with his lavish living lifestyle. The contributing factors were the standards of care not being met, unwarranted medical procedures, financial liabilities, and association with the stent company. The contributing factors were the physician not practicing at the set standard of care for these invasive procedures. He was providing very expensive interventions when they were not warranted or at occlusions less than 70%, and either fabricating data or overreading test results to say that the patients needed the heart cath and stenting. This makes the physician as well as the hospital liable during lawsuits and the insurance companies denying claims. Not so much on the physician, but the hospital will have a loss of revenue. There is also the factor of the physician receiving an unknown amount of money, enough to fund his lavish lifestyle that even his peers cannot afford from the stent company. He is receiving this using their stents, doing luncheons, meetings, and promotional talks. This is referred to as a kickback, and it is bad. Responsible management. Chief Executive Officer, Chief Medical Officer, and Cath Lab Supervisor. The CEO is ultimately responsible for the day-to-day operations of the hospital system. There should be better QA with patient follow-up. The ethical issues with Dr. Know-It-All and the stent company would have better known with records review of patient procedures. There would also have been some verification through the medical supply as to the quantity of stents that were being used, noting the purchase and supply and demand levels. The Chief Medical Officer is who Dr. Know-It-All should directly report to. The Cath Lab Supervisor should have knowledge of Cath Lab scheduling to see if any one physician is always in the Cath Lab and who is requiring a team to run the lab, how many stents are being placed, what manufacturer of stent is being used, and by what physician to see if any of this data skews in any one direction. Management issues. Lawsuits, standards of care, quality assurance, mediation, and prevention of further issues. Because of Dr. Know-It-All's behavior, the hospital is now subject to lawsuits. Standards of care need to be evaluated. Quality assurance needs to be further investigated and upped. Mediation needs to occur with physicians, especially Dr. Know-It-All if he is to continue, and prevention of further issues needs to be addressed. For prevention of further issues, changes should be made in the policy and procedures to clearly state what percent of occlusion the medical board of the hospital believes a stent should be placed at. So far, it is agreed that greater than 70%, and what testing is it to be done to cardiac cath with possible PCI. Is it a stress, echo, or does patient just need to be symptomatic on exam? Also, an addendum needs to be made to the policy and procedures about anti-kickbacks and what physician association with vendors is acceptable. Procedure criteria. Following medical guidelines and/or recommendations, being sure that the patient meets the necessary criteria to have a procedure. Prior to a heart cath, a symptomatic patient generally undergoes a stress test, either exercise or nuclear depending on the patient, and an echo to evaluate cardiac structure and function. If warranted, then a cardiac cath is performed showing any blockages, and any severe blockage, generally greater than 70%, are treated with a stent or PCI. If the blockage are less than 70%, treatment is usually medication, symptom management, and close monitoring. A secondary review by a peer cardiologist in that department prior to any procedure being completed may circumvent any further issues.